Preparing for labor goes beyond packing a hospital bag. It involves understanding how to work with your body to make the entire process smoother and more effective. Every labor experience is unique, but these evidence-based tips can help you stay focused, comfortable, and in control. Movement helps your baby descend and encourages contractions to become more effective. Changing positions every 20 to 30 minutes prevents fatigue and promotes better alignment. Breathing helps conserve energy and reduces tension. Slow, deep breaths during early labor keep you relaxed, while patterned breathing during active labor helps you stay focused. Labor is physically demanding. Drink water or oral rehydration fluids and eat light, energy-giving snacks to maintain strength. Warm baths, showers, massage, and compresses can help you cope with contractions, reducing muscle tension and making each contraction more productive. Upright positions like sitting, standing, or squatting use gravity to help your baby move down, making contractions more effective and shortening labor duration. Listen to your body and rest when needed. Short rests between contractions help preserve your strength, allowing you to switch to comfort measures when overwhelmed. A calm, encouraging atmosphere promotes hormonal balance and smoother progress, helping reduce fear and anxiety.